Mr. Shabib Banu, who are board members.
Briefing the Oversight Committee on the COVID-19 vaccine pipeline, the regulator says the full approval of the vaccines is ongoing.
We've got the following products being authorized. It is the AstraZeneca that was authorized under Section 21. It is the Pfizer-BioNTech that was authorized also under Section 21. We have the Janssen J&J vaccine that has conditional market authorization. We also have the Sinovac Coronavac vaccine that was recently authorized. Now, the time frame that it takes, and as we've indicated, we've expedited our processes. And on average, depending on the quality of the submission, depending on the information that's available at the time, it would take us about 90 working days or so to finalize these, because we've expedited our processes for all COVID-related products. But there's still a bit of back and forth that takes place between us and the applicant.
But the animal data will overlap with the lab data. The lab data overlaps with the phase 1, phase 2, phase 3. These studies overlap. And even when we introduce these vaccines, what we now are developing and we have is what's called an effectiveness study, where we look at breakthrough infections. We say how effective and how safe are these vaccines once we introduce them to the wider community. So you can't stop with these clinical trials. You have to look at them for the wider community.
The Russian Sputnik V vaccine is also under review. SAHPRA says it's also checking the adverse reports after immunization.
In total, so one individual can report one or more than one adverse events. So in total, there's been about 3,730 adverse events following immunization that have been reported. And we then analyze that against these two vaccines that have been rolled out in the country. There's also been those that are reported for events of special interest. We have had some fatalities, and there's causality studies that are currently.
SAHPRA maintains that ivermectin cannot be used to treat COVID-19. The regulator says it can only be used in approved control environments like clinical trials.
What's concerning is while we've got this mechanism, and there's a mechanism to report by the healthcare practitioners, we're not receiving as many reports as per these applications. And would really like to urge, the healthcare practitioners to report wherein they've got this authorization from us, because we need to be able to collect as much data as we possibly can on the benefits or the harm of this product, if there is harm. So, we continue to monitor this, but the reporting is very, very poor at this point.
SAHPRA says it must be given space to do its work independently and without pressure. Ulilani Philip, SABC News, Parliament.